everyone. Thank you for joining the NeedyMeds special topic webinar, The Financial Impact of Cancer, presented by Triage Cancer. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And before we get started, I want to cover some housekeeping tips so you get the most out of today's presentation. If you have questions, you can type any you may have into that questions section of your GoToWebinar control panel, but know that we will reserve answering questions until the end. If we don't have the time to answer your question, we will follow up with you via email. Of course, we will provide the contact information for both NeedyMeds and Triage Cancer. This webinar is being recorded and will be available for viewing on the NeedyMeds YouTube channel. You can find the PowerPoint slide decks accompanying this webinar in the handout section of your control panel. So let's get started with what is NeedyMeds. NeedyMeds is a national nonprofit founded just over 2 decades ago by a retired physician, Dr. Rich Sagel, who is still our president. On your screen is all of our formal wording, including our mission statement, our vision statement, and how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. I always like to put a screenshot of our homepage up because really our website is the face of our organization and gives me a chance to point out a few things. If you're looking for healthcare cost savings resources, begin your search under the Patient Savings tab. If you're interested in educational information, such as ordering brochures and drug discount cards, signing up for webinars, or getting on the list to receive our monthly newsletter, you would do that all under the Advocates tab. I mentioned that this webinar is being recorded and will be available on our YouTube channel. And you can find a link to that on the top right-hand side of our page with all of the other social media icons. It's the third one from the left. I suggest subscribing because that way you will know when new content is being added and you won't ever have to miss a webinar. And you can and you can check out and register for all upcoming webinars on the calendar of events on the bottom right hand of our homepage. So as you saw a couple of slides ago, a big part of our mission is educating people. And we do that by letting them know about NeedyMeds, but also by letting people know about other resources available for diagnoses that they're living with, which is why we are so pleased to have our guest here with us today from Triage Cancer. Triage Cancer is a national nonprofit that provides education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. And it is my pleasure to introduce our panelist, Monica Bryant, Esquire, who is going to walk us through tips that will help lessen the financial impact of a cancer diagnosis and treatment. Monica is a cancer rights attorney, speaker, and author dedicated to improving access to quality information on cancer survivorship issues. She is co-founder and chief operating officer for Triage Cancer. Throughout her career, she has provided hundreds of educational seminars, written articles and blogs, appeared on community television and radio shows, and authored a book on cancer rights law. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Monica. So bear with us while we do that. You may hear a few moments of silence. And as Monica is taking over the screen, I will remind everybody that if you do have questions, you can go ahead and submit them into that questions section of your GoToWebinar control panel. And Monica, it looks like you are ready to take that screen. Thanks everybody for your patience and enjoy the presentation.
Thank you so much, Carla, and I am absolutely delighted to be here today. I really appreciate our partnership with NeedyMeds, given everything that individuals who are coping with cancer and other serious illnesses have to cope with. We really do believe that collaboration is so incredibly important. Now, some of you may have heard about Triage Cancer in the past. We may be new to some of you, but for those of you who aren't aware of our organization, I just wanted to spend a couple of quick minutes talking about all of our services so that if after today you have questions about other cancer survivorship topics, you know where you can go for resources. So Triage Cancer is a national nonprofit organization that provides education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers. And we provide this education in a couple of different ways. First, we host a speakers bureau of experts in all types of cancer survivorship issues, available to any organization putting on an event. We also have a panel specifically of survivors and caregivers who are experts at communicating their experiences to a variety of different audiences. We are delighted to participate in events all over the country. Some of the events, like today's, are hosted by our partners in the community, and some are events that we host ourselves. One of the events that we host ourselves is our Triage Cancer conferences, and we host 3 of these conferences per year around the country. They're completely free to attend, and they're open to anybody who is interested in learning more about these topics. We provide free continuing education for nurses and social workers, and applications are pending to provide continuing education to attorneys as well. For anyone who's interested, please feel free to take a look and register on our website. Now, just like NeedyMeds, we host a variety of webinars. They tend to be about once a month on all sorts of different topics. We also record all of our webinars as well. So for healthcare professionals on the line, if you have a patient who has questions about appealing a health insurance denial or how to apply for disability insurance, instead of trying to walk them through all of the different steps, you could certainly refer them to one of our past webinars. And again, they're all free to attend. Now, we host 2 trainings specifically for healthcare providers because, in our opinion, healthcare providers are really on the front lines, and they're the ones that are being asked these questions about health insurance access and what do I do about my finances and what should I do about my job. And yet, very rarely are healthcare professionals ever given the tools or the education or the training to answer those questions. And so we're trying to fill that gap. The first training is Navigating Cancer, Work, and Insurance, where we spend the whole day talking about employment issues with just a little touch of insurance at the end. And then we also have our Insurance and Finance Intensive. And this is a day-long free event where we really get into the weeds about all things health insurance, disability insurance, and finances. Again, all free to attend and free continuing education for social workers and nurses. And then we have a number of educational materials and resources online. Our quick guides are designed to be a snapshot of a particular topic, and you'll see throughout my presentation, I've included the links to the relevant quick guides. But again, all of this can be downloaded for free from our website, or you can request multiple copies on our website using our material request form. And then we recognize that people learn in different ways. And so we've also created some animated videos on a variety of topics. We have one on health insurance basics, one on picking a plan, because none of us are ever taught how to do that. One on dealing with side effects at work, cancer survivorship plans, and one on clinical trials. These are all available in English and Spanish and provide subtitles as well. And we're frequently creating new ones, so check back often. We're super excited to announce that with the support of the California Dialogue on Cancer and Genentech, we now have many of these resources in Spanish as well. Now, you will see throughout today's presentation that there are times where I say you have to contact an agency in your state, but it's easier said than done sometimes to find that contact information in the vast interwebs that we sometimes have to deal with. And so Triage Cancer has compiled all of that relevant information in one place for you. So if you go to our resources tab and click on your state, you will see the contact information that's specific to your state. And because where you live can impact what protections you have access to, we have charts of state laws on employment, disability, health insurance, and other cancer-related issues. And then finally, Cancer Finances is a site that we host in partnership with the SAM Fund that provides practical information on all the topics that can impact your finances. What's unique about this particular website is it's designed to guide users to information that's most relevant to their situation. So the website poses questions to you, and then based on the answers to your questions, it will take you to relevant information. We are frequently updating and adding content to this site, so check back often. And then we have our educational blog that provides not only substantive information, but also because things are constantly changing in the law and in health insurance specifically, this is how we share late breaking news. So without further ado, I want to get into the substance of today's topic, which is really how do we minimize the financial impact of a cancer diagnosis, or really any serious illness that one might be diagnosed with. Many of these things are not specific to cancer. We simply talk about them through the lens of cancer. Now, if you've ever tried to put together one of those giant jigsaw puzzles at some point, you could imagine how much more difficult that task becomes if you've never seen the picture of what the final product is supposed to look like. And that is how it can feel to a lot of individuals who are navigating this complex maze of cancer. They're diagnosed, and then they find out along the way that there are so many things that they need to think about and deal with, decisions that have to be made, but they don't always know what that overall big picture looks like. So through the various programs we provide, we try to give individuals the pieces so that they can put together their own unique puzzle. And just some of the pieces of that whole picture include the specifics of employer policies, federal and state laws, employment contracts, and certainly how finances and insurance coverage come into play. And all of these pieces are important because it's in the cases where people don't understand what the law is and what their rights are that they ultimately fall through the cracks. So in 2013, researchers from Duke coined the term financial toxicity. And in their research, they focused on the financial burden of a cancer diagnosis and how significant that burden can be, not just in an acute way when somebody is still in active treatment, but also that long-term impact of the financial burden long after active treatment may be over. And this isn't necessarily about somebody's bank account and the dollars and cents, because we also have data on how that financial burden causes stress, depression, anxiety, and ultimately diminishes somebody's quality of life. Now, this is a relatively new term. However, this is certainly not a new problem. We just have a way to talk about it now that's sort of agreed upon. But there's no easy solution to the problem of financial toxicity. And that's because there are multiple contributing factors. And all or most of these factors need to be addressed to effectively minimize the financial toxicity. So the primary culprit of financial toxicity is having inadequate health insurance. Of course, potential changes to somebody's employment status could impact finances. If you have to take time off work or need to access disability insurance, how is that going to affect somebody's finances? And then certainly we don't get a pause button with a cancer diagnosis. Life continues to go on, and normal life changes that would cause potentially a financial impact on their own are sometimes magnified when placed in conjunction with a cancer diagnosis. And effectively navigating all of these changes is often rooted in having a good understanding of the law. So today I'm going to spend the bulk of the hour talking about health insurance and how we can effectively utilize and choose health insurance so that we can minimize these out-of-pocket costs and ultimately minimize the financial toxicity of a cancer diagnosis. But the problem is that there is a general lack of understanding in this country around health insurance. It is like learning a totally new language. And we have so much data that shows there isn't just one subset of Americans that don't understand health insurance. People who get their insurance from an employer don't understand their health insurance. Healthcare professionals don't always understand their insurance. So if you don't understand your health insurance, you are not alone. Certainly, I hope that after today, you'll have a slightly better understanding of it. And of course, I'll point you to some resources where you can continue to learn. Now, something as quote unquote basic as having an understanding of the terms that are used in a health insurance policy can make a really significant impact. So before I get into the specifics about how to use a policy, I just want to make sure we're all on the same page with respect to some terminology. These are the terms that are often used, but frequently misunderstood. So starting at the beginning, when we talk about a premium, we're talking about the amount that you're going to pay monthly just to have health insurance. And you're going to pay this whether or not you go to the doctor that month. It is very similar to having car insurance all year long, but never getting into an accident and submitting a claim. That's your premium. Now, there are some additional costs that you will incur when you start to use your health insurance. First is your deductible, and this is a fixed dollar amount that you have to pay each year. This amount is going to depend on your plan. Some plans have a $0 deductible, some plans have a $6,000 deductible, but it's always going to be shown to you in a dollar amount. And the deductible is what you have to pay out of pocket before your health insurance company will cover their share of the costs for your medical care. Now, their share of the costs is referred to as co-insurance, otherwise known as cost share. So two terms for exactly the same thing, just to make things a little bit more complicated. The cost share or the co-insurance is always going to be presented to you as a percentage. So for example, if you have an 80-20 plan, that means that your plan is responsible for 80% of your healthcare costs once you've met that deductible, and you're responsible for 20%. A copayment is again a fixed dollar amount, and it's going to depend on your plan as to what that copayment is. But this is an amount that you have to pay out of pocket each time you receive care. So for example, many policies have something like a $25 copayment when you go to the doctor, and you have to pay that amount before they even let you through the door. And then finally, I want to talk about your out-of-pocket maximum. This again is going to be a dollar figure. And the way that we get to our out-of-pocket maximum is typically by adding up what you've spent out of pocket for your deductible, anything you spent towards your copayments, and anything you've spent towards your coinsurance. And once you reach that out-of-pocket maximum, that is generally going to be all that you have to pay for the rest of the year except those monthly premiums. Now, of course, like with everything, the devil's in the details. Typically, health insurance policies will only count payments made towards in-network services towards your out-of-pocket costs. Towards your out-of-pocket maximums. And we've seen some plans throughout the years start to get creative where they carve out the deductible from your out-of-pocket maximum, or maybe they carve out co-payments from your out-of-pocket maximum. So it's very important to look at your specific policy to figure out how you reach that out-of-pocket maximum. But we're going to show you why understanding your out-of-pocket maximum and how this all works is incredibly important. So meet David. David has a plan with a $2,000 deductible, an 80-20 coinsurance, and a $4,000 out-of-pocket maximum. David gets into a car accident and ends up with a $102,000 hospital bill. But what does he actually have to pay? So the very first thing we all have to pay in the year is our deductible. So he pays his $2,000, which leaves $100,000 left of his bill. And he's responsible for a 20% coinsurance, which is equal to $20,000. But does David have to pay $20,000? I'm going to pretend I can see you all shaking your head no. And that's the correct answer because David has a $4,000 out-of-pocket maximum. So he pays his $2,000 deductible. He pays another $2,000 of that coinsurance amount for a total of $4,000. And that is all he has to pay for the rest of the year as long as he goes to in-network providers and his premium. So certainly David is a simplistic example of how this all works. If you'd like to hear that again, I just want to remind you that we do have a short animated video that goes over that example as well. Now, sticking with some important terms to use, most health insurance policies have a network of providers that they've contracted with to provide services at a set rate. And if you go to providers within that network, you'll be charged that contracted rate. But if you go to a provider out of the network, typically your insurance policy won't cover the services at as high of a rate, or they may not cover out-of-network services at all. Another term that we wanted to talk about is surprise billing. And surprise billing and balance billing are often confused in the news, and they're used as the same thing, but they're not actually the same thing. So a surprise bill is when somebody goes to an in-network facility, but then somewhere along the line sees an out-of-network provider and receives a bill for that service. It happens a lot if, let's say, you go to a hospital that's in network and the surgeon is in network, but the anesthesiologist is out of network and you don't know that. And then you receive a huge bill for that anesthesiologist because they're out of network. Now, several states are trying to deal with this issue and are passing protections to try to limit the ability for those providers to saddle consumers with surprise bills. But surprise billing is very different than the concept of balance billing. Balance billing is where patients are charged the difference between what the provider charges and what the insurance company pays for a service. But if that provider is in the person's network, they are not permitted to balance bill because they've already agreed to take a certain amount from the insurance company for those services. So let's say, for example, the provider charges $100 for the service, but they've agreed with the insurance company that they're going to take $70 for that service. If that provider's in network, then they can't turn around and charge the patient for the extra $30. So similar but different, and an important difference, and why the terms shouldn't be used interchangeably. Now, within our healthcare system, we have a couple of different options for types of managed care plans. All of these plans use a network of physicians and hospitals and other healthcare providers to try to give people the highest quality of care for a certain rate. But there are a couple of important differences here. So starting with a HMO, or a health maintenance organization. HMOs generally have a smaller network of providers and require people to always start with their primary care physician. If the primary care physician, or PCP, cannot solve the problem, then the primary care physician refers the patient to a specialist. The primary care physician acts as sort of the gatekeeper of all of that person's care. So there's a few additional hoops to jump through, and you have a smaller network of providers. In exchange, you have lower costs. Now, when you compare that with an EPO, where there's a slightly larger network of providers as compared with an HMO, but there's going to be no out-of-network coverage. So yes, you have a larger network to choose from, but that's all you get to choose from. And most EPOs don't require you to start with a primary care physician. In exchange for a little bit more choice, you pay a little bit more. And then finally, a preferred provider organization, or a PPO. Of the three of these, it's going to have the largest network of providers, and many will provide some out-of-network coverage. So if you go to a surgeon that's in network, they'll pay, let's say, 80%. If you go out of network, they'll only pay 50%. With PPOs, you do not need to start with a primary care physician. So in exchange for the most amount of choice, PPOs are usually going to cost the most. Now, I typically get asked when I'm doing, in-person presentations, well, which is better? It 100% depends on the individual needs and what is in their community. There are some places we travel to across the country where the HMOs are wonderful, and why would anybody go outside of that? And then there are places that we go to where that's not the case, and really the PPO is the best option. So there's no one size fits all here, and each of these plans sort of plays a role. Now, in the United States, approximately 50% of Americans get their health insurance from their employer. So it begs the question, what happens if somebody has to stop working due to a diagnosis of a serious illness? What do they do for their health insurance? COBRA is the federal law that allows eligible individuals to keep their existing employer-sponsored health insurance coverage after they experience a qualifying event. So what's fantastic about COBRA is that it's the exact same health insurance. So you don't have to try to go find a new plan that has the same co-payment and deductible and network and all of that. It's the exact same plan. The downside to COBRA is that it can be incredibly expensive. So often when an employer offers health insurance, they pay a portion of the premium and the employee pays a portion. Well, when someone switches to COBRA coverage, they are now responsible for 100% of the premium, plus sometimes a 2% administrative fee. So it can be very expensive. Now, COBRA applies to employers with 20 or more employees. And the length of time that you can keep your COBRA coverage depends on the qualifying event. So if you've left your job or reduced your hours so that you're no longer eligible for benefits from your employer, generally speaking, you're going to be able to keep COBRA for up to 18 months. If, however, let's say you're losing your coverage because you are divorcing the person who has the coverage through their employer, you'd get coverage for up to 36 months. Now, most states also have a state COBRA law, and the laws definitely vary state to state, but most are going to cover those smaller employers, so up to 19 employees. And the amount of time you're going to keep COBRA coverage varies greatly depending on the state. But if you're interested in your state's COBRA statute, you can check out our chart of state laws, and I've provided the link here for you as well. Now, when the Affordable Care Act was passed, a lot of people would say to me, why would anyone elect COBRA? It's so expensive. There's no point in COBRA anymore. We don't need it. But that's not necessarily true. COBRA may still be a very good option for some people. So it may be that the coverage that you were getting from your employer is far superior to what you could buy in the open market. It could be that the network is much better than what you could get, or at least has your providers in it. But it may also be about cost. If somebody has already met their deductible for the year, or if they've already met their out-of-pocket maximum for the year, it may actually be more affordable to pick the more expensive COBRA option and know that that's all they're going to pay for the rest of the year. But you cannot know that until you do the math, and we are going to talk about how you do the math in just a few minutes. But I did just briefly want to talk about Medicare, because Medicare is one of the 2 federal health insurance programs that cover about 60 million people. I'm sorry, that's an old slide that I have here for you, but they cover a good chunk of Americans. Now, in order to be eligible for Medicare, you must be a U.S. citizen or a legal resident. You must also be over the age of 65 or have been receiving Social Security disability payments for 2 years, or have end-stage renal disease or ALS. There are 4 different parts to Medicare. Part A is your hospital insurance. And if you have worked and paid into the system over your working career, Part A will likely be free for you in terms of your premium. If you haven't worked and paid into the system, you may still access Medicare. You'll just have to pay a monthly premium. Now, Part B is your medical insurance, and there is a premium even if you've paid into the system and a deductible. When we put Part A and Part B together, that's referred to as original Medicare. Now, Part D is your prescription drugs. And with your prescription drugs, there is a premium. It's going to depend on the plan you choose, and an annual deductible. Now, it turns out that for some people, keeping track of potentially 3 different premiums and 3 different deductibles and 3 different cost shares is complicated. So an alternative was created in Part C, also known as Medicare Advantage plans. And Advantage plans allow you to receive your Medicare Part A, B, and sometimes D
So, Monica, this is Carla. I'm experiencing some
through a
audio
managed
difficulty.
care plan. So that's going to be more.
Hi, Monica. I'm not
Oh
sure if you
dear.
can hear me.
Okay.
Yeah,
Yes,
I
can you hear me?
apologize to you. I apologize to you and our audience. Just to interrupt, you may want to go back a couple of sentences or two because we lost contact. We lost your audio for just a moment.
Absolutely. So I'm so sorry for that. And please feel free
I
to
think it
pipe
was
in.
right after you just were describing Part D.
Okay, so it turns out that for some people, keeping track of potentially 3 different premiums and 3 different deductibles and 3 different cost shares is complicated. And so an alternative was created in Part C, also known as Medicare Advantage plans. And with Advantage plans, you pick one plan that's going to operate more like the HMOs and the PPOs that we're used to in individual insurance. So you receive all of your Medicare Part A, B, and D services through one plan. Now, there's pros and cons, like with everything. There's going to be less choice with Medicare Advantage plans because there's a smaller network. But again, it's less complicated. So like with HMOs and PPOs, people often say, well, which is better? And there's no one size fits all. It definitely is going to depend on the individual's needs and what's available to them. Now, I will tell you, and I'm so sorry, I'm not quite sure. I think my slide deck didn't save properly because these are showing all the 2018 dates, but this exists for 2019 as well. So if you go to our past webinar recordings, you'll see the Medicare webinar that we did last year for a lot more detail in all of that. And I'd be happy to send Carla the updated slide deck to send out to all of you if you would like that. Technology is apparently not our friend today. And I'm assuming since I haven't heard from Carla that you all can hear me now, but if you can't, please pipe in.
Yes, this is Carla. I can hear you perfectly, and I'm not getting any further feedback from our audience that there's audio difficulty. So I think we're in the clear. Thanks for checking in.
Fantastic. Thanks, everybody. So the Patient Protection and Affordable Care Act is also known as the ACA or the Affordable Care Act or Obamacare. And there's a lot of confusion still about this law and what is actually included in it. But this law was actually passed almost a decade ago on March 23rd, 2010. And the way that it was designed was it was supposed to phase in new provisions over time. This is a huge piece of legislation and things have changed over the years, but I really want to just focus today on the new consumer protections and benefits that this law has provided us. So when we look at these consumer protections collectively, they were designed to make insurance more adequate and ultimately to ensure that if somebody has the right plan for them and they get a serious diagnosis like cancer, they don't end up bankrupt. So how did they work on this? So the first thing that the ACA did was it said that health insurance companies can't place dollar limits on the amount that they're going to pay out for somebody's healthcare costs. They also can't cancel somebody's policy because they've made a mistake or omission in their application. They say that insurance companies have to cover the routine costs of participating in clinical trials, and certain policies have to cover preventative services. Now, these provisions and protections don't just impact or benefit the people who buy their own insurance or people with low incomes. It really impacts most of us as consumers of healthcare, and that's a big misconception. But the reality is having access to adequate health insurance is only half the battle. The sad reality is that many individuals with a serious illness, once they will face a claim denial at one point or another. And it's crucial for them to understand that you don't necessarily have to take no for an answer. Insurance companies have an internal appeals process, and the details are going to vary based on the company. So you should definitely check your own company's policy. But essentially, it's a way for you to go back after you've received a claim denial and say, please reconsider this for X, Y, and Z reasons, and here's my evidence to support that. Now, thanks to the Affordable Care Act and sometimes state law, all private plans also have to have what's called an external appeals process. This is sometimes called independent medical review or external medical review or IMR. And again, the details vary state by state, but we've compiled all of that contact information on that state resources page. We also have an hour-long webinar that goes into great detail about the steps to take to an appeal and a claim denial. And I fully recognize that here we are saying to somebody who is sick and already dealing with so much that you may also have to add battling with your insurance company to the list of to-do things to do. But we know that it is absolutely in patients' best interest to appeal those denials, because somewhere around 60% of all appeals are decided in favor of the patient. So absolutely one more thing for you to do, but could be very, very beneficial. Now, in addition to some of the new protections that we've received under the ACA did two incredibly important things. And frankly, in my opinion, if the ACA did nothing else but these two things, it would still be game-changing for individuals coping with cancer and other illnesses. The first thing the ACA did was it limited what insurance companies could look at when they were deciding how much they were going to charge. So they can only look at, are you buying an individual plan or a family plan? Certainly individual plans will be less expensive. Your geographic location, your age. So yes, the older you get, the more expensive insurance will become, but there's a cap on how much more insurance can become. And then in most states, if you've used tobacco. So the two things really missing from this list that were a problem in the past were gender. So most women don't realize that they were being charged more for the exact same policy as men. And certainly pre-existing conditions and health status cannot be taken into account. And then the ACA also said that insurance companies can no longer deny selling somebody a policy or excluding coverage for pre-existing conditions. And as I mentioned, this is sort of old hat at this point. We've had it for about 5 years, and I think we've all gotten used to it. But there have been a lot of discussions around repealing the ACA, but keeping the pre-existing condition protection. But when those elected officials were sort of pushed a little further in those statements, what we realized is they were referring to number 2, not number 1. And the problem with that is, great, you've told me that I can buy insurance even if I have a pre-existing condition, but you haven't put any regulations or limits on what they can charge me. And now it is so astronomically expensive, I can't possibly buy insurance. So in our opinion, to truly stay an effective protection, these two provisions must stay coupled. Now, I will say that we have to stay tuned because there is currently a court case, Texas v. US, that is working its way through the courts. And this court in Texas has actually already found the Affordable Care Act to be unconstitutional. And it's currently going to the Fifth Circuit for their decision. So this is unfortunately is not a done deal. Now, the reason for that is that in the Affordable Care Act, there was a provision that said that most individuals have to have health insurance coverage or pay a penalty. So if you had individual plans, Medicare, Medicaid, COBRA, high-risk pools, you were fine. Now, in a tax bill, the current administration and Congress reduced that penalty to 0 starting this year. And that's what the court case hinges on. I don't have time to go into all of the details about the court case, but if you are interested in sort of the legal arguments and the why behind all of this, at our Triage Cancer blog, we have a blog post that goes through the timeline and the different legal arguments, and we've hopefully written it in a way that anyone can understand it. Now, some health insurance companies will also sell short-term plans, and these plans have definitely been expanding over the last couple of years. They're very attractive to some people because they have a very low monthly premium, so they seem incredibly affordable. The problem is these short-term plans are not required to provide the consumer protections included in the ACA. So they're able to deny selling to individuals and excluding treatment for pre-existing conditions like cancer. Additionally, most of them have huge out-of-pocket costs. So they have a low monthly premium and then someone goes to use the health insurance and they have to pay a huge amount, and they can end mid-year and there's no trigger at that point for a special enrollment period. So it's not always clear to people that they're buying a short-term plan until they're kind of in trouble with it. So we just want people to be aware of it and make sure that they're asking the right questions so that they know what they're buying. Now, prior to January 1st of 2014, there were only 4 ways for somebody to access Medicaid, which is a federal program that's administered by the states to help individuals with low incomes, low resource levels, and who fall into one of these categories and can walk through one of these doors. For most people coping with cancer, they would go through that age, blind, disabled door. But the problem is if they had a savings account with more than $2,000 in it, they didn't qualify based on the resource level. So the ACA actually created a 5th door of coverage that was just based on income. So for individuals who have an income at or below 138% of the federal poverty level, they would be able to access Medicaid. Now, this was supposed to happen across the country, but a few years ago, the Supreme Court got their hands on the law and basically made it voluntary for states to expand. And this is where we stand today, with 37 states having expanded their programs and 14 states not expanding their programs. And all of these footnotes indicate the states that expanded after the initial expansion period in 2014. So this is the slide that changes most frequently in our presentation because things are constantly moving back and forth. Now, the ACA also gave us a new way to shop for health insurance. These were originally called exchanges in the law, but no one knew what that meant. So they were renamed state health insurance marketplaces. But it turns out people don't really understand what that means either. The easiest way for us to explain these is by comparing them to a health insurance shopping mall, or Amazon for health insurance. The marketplace is simply the way that you shop for the plans. But what is being sold in these marketplaces is actually individual health insurance policies sold by a variety of companies. So Humana, Aetna, Blue Cross Blue Shield, those are the types of companies that are selling their products. They're just doing it through this marketplace. So there's a big confusion that these plans are government plans or Obamacare plans, and those just don't exist. There are some benefits to purchasing through the marketplace. So there is a cap on the out-of-pocket maximum. This year we saw the highest increase in the cap. So this year it's $7,900, which is certainly a lot of money for an individual. But if you remember back to the David example, he was stuck with a $20,000 bill. So even paying $7,900 is better than getting to that $20,000. The other advantage to buying through the marketplace is that there's financial assistance being offered. And so for individuals who have a have an income, between a certain percentage, they may have access to premium tax credits or cost sharing subsidies. So I'm now hearing a little bit of feedback on the line, so I'm not sure if you all are muted or not, but hopefully, again, you can still hear me. Now, in the marketplace, one of the benefits is that the plans are standardized based on their cost share. So bronze plans have the lowest monthly premiums, and they're going to cover 60% of your healthcare costs, and you cover 40%. Silver is 70-30. Gold is 80-20, and platinum is 90-10. So consumers can now shop for health insurance much like we do everything else. Only show me the black sweaters, only show me the front-loading washing machines. Similarly, I can say, only show me the platinum plans. Now, the financial assistance, we have lots of resources on our website that goes over it. So I'm going to skip over for today because I want to make sure to leave enough time for questions. But I did just want to mention that in order to enroll through the marketplaces, you can always start at healthcare.gov, but I fall into the trap of only talking about it as an online resource. It is not. There's a toll-free hotline. You can get a paper application, and you can also, in most places, in many places, actually get in-person help. When the law was originally passed, there was a budget to train marketplace assisters to help people walk through the marketplace and their options. But I did just want to mention that there's been a 90% cut to that program. So we've seen some states that currently don't have any assisters left. So keep that in mind. Now, Medicaid applications are accepted year-round. The marketplace for 2019 is closed, but the 2020 marketplace will open on November 1st, we believe, and close December 15th. But even if somebody buys a plan November 2nd, that plan doesn't start until January 1st of 2020. Medicare open enrollment is always between October 15th and December 7th. And again, that plan will start January 1st. Employer plans absolutely vary, but many offer them in the fall, open enrollment in the fall, so that the plan then again starts January 1st. But thankfully, the ACA recognized that things don't just happen during open enrollment. And so they created a special enrollment period. And this is when you have a life-changing event that results in you losing your minimum essential coverage. So for example, if you lose your job, that triggers a special enrollment period and you have 60 days to shop for and enroll in a marketplace plan. So now if someone were to lose their employer-sponsored health insurance, they have more options than ever before. We talked about why COBRA or state COBRA might still be a really good option for somebody. It could be about picking an entirely new plan in the marketplace special enrollment. It could be that they have access to another group plan. So maybe they can go on their spouse's plan at work, or if they're under the age of 26, maybe they can go on their employer plan. Or maybe now because of circumstances, they're eligible for Medicare or Medicaid. So I just want to briefly talk through how we pick a plan. So as I talked about at the very beginning of the hour, one of the most effective things that people can do to mitigate the financial toxicity of a cancer diagnosis is to have the right health insurance plan. But how do we go about picking the right health insurance plan when we have more than one option to choose from? Now, I fully recognize some of you may start to tune out thinking, oh, I have insurance right now. Why do I need to know this? But here's the thing. Picking a health insurance plan is not a one and done task. We actually have to do it every single year. and our needs may change year to year. So the analysis that I'm about to walk you through is certainly relevant if somebody is comparing their options between two marketplace plans, if they have more than one employer option, if they're trying to decide, hey, do I take my employer plan or do I just go buy a plan in the marketplace? Or if they are trying to choose between Medicare plans. I'm going to use the marketplace as an example, but again, this analysis can be applied regardless of where you are getting your health insurance. So here we have a person who can buy a bronze HMO for $173 a month, a silver PPO for $271 a month, or a platinum plan PPO for $398. Now, some of us might look at that $398 and think that's insane to pay that every single month, but we have to look at the other two columns. So that bronze plan is a $6,000 deductible and a $6,000 out-of-pocket maximum. The silver plan has a $25 deductible and a $5,200 out-of-pocket maximum. And the platinum plan has a $0 deductible and an $1,100 out-of-pocket maximum. Now, just by looking at this information, assuming that somebody has a serious illness and they're going to hit their out-of-pocket maximum, which is many of the people that we talk to in the cancer community, we have to do the math to figure out which is going to be the most affordable at the end of the year. And the way that we do the math is we take the monthly premium and we multiply it by 12 to get how much we're going to pay in premiums for the year. And then we add the out-of-pocket maximum. And as you can see here, I've done the math for you. And that platinum plan with the $400 a month premium actually ends up saving this individual over $2,000 compared with the quote unquote cheap bronze plan. So we have to do the math to figure this out. But looking at the total annual cost is only the first step. Some plans might have a high deductible, like that bronze plan up top, which means that you have to pay a huge amount of money up front before your plan starts picking up their share of the costs. So with that plan with a $6,000 deductible, someone has to write a $6,000 check before the plan has even paid a penny. When we compare that with the quote unquote expensive platinum plan, it had a $0 deductible, which means that that plan starts picking up 90% of the costs right away. So what that effectively does is it spreads out the amount that you have to pay out of pocket throughout the year in your higher monthly premiums, rather than coming up with a big chunk of money all at once. And then after, of course, you've looked at the cost of the plan, you need to make sure that your doctors and other healthcare providers are in that plan's network, because you want to actually maximize the plan and pay the least amount out of pocket. And similarly, you have to make sure that your prescription drugs are covered and at what rate. Now, we have an animated video on this topic as a reminder about how to pick a plan. So if you'd like to hear what I just said again and don't want to watch the whole webinar, you can just go watch the 6-minute video to understand how to pick a plan. Now, of course, as we talked about at the top of the hour, health insurance is only one of the contributors to financial toxicity. All of these other things can play a role as well. And Triage Cancer, as well as NeedyMeds, have resources on a lot of these topics to try to help you. So I certainly hope that you'll forgive us for the technical difficulties today and continue a relationship with both NeedyMeds and Triage Cancer. And with that, I'm happy to take questions if there are any.
Monica, thank you so much for such a thorough presentation. It's a great example as to why NeedyMeds is so proud of our relationship with Triage Cancer. They take these difficult and confusing topics and break them down into bite-sized pieces of information that we're all able to digest and understand and hopefully utilize to make better decisions. And it's really important, certainly to the population that is living with a cancer diagnosis or caring for someone that's living with diagnosis, but really the reality of choosing a healthcare plan for ourselves and our families affects all of us. So thank you so much for sharing your expertise. I do see some questions coming in from our audience, and a reminder that you can submit any questions you may have into that question section of your GoToWebinar control panel. And if we don't get the chance to answer your question, as I said, we will follow up with you via email, and I will put the contact information for Triage Cancer and NeedyMeds at the end of this presentation. In the meantime, as Monica said, we hope you rely, in addition to Triage Cancer for assistance, we hope you remember that NeedyMeds is here to support you as well. If you are, we're talking about the difficult topic of how finances can impact a cancer diagnosis, puts such a burden on your budget. We hope you remember that NeedyMeds is here to help. What you're looking at on your screen are all of our most popular healthcare cost savings resources. And as I mentioned at the beginning of the hour, if you are interested in checking these out, just let your cursor hover over that patient savings tab and the navigation bar on the top of needymeds.org. And of course, we would welcome you to join one of our upcoming overview webinars. And in fact, as you can see on your screen, we do have a NeedyMeds overview webinar coming up later this month that we hope you join us for, because it'll teach you more about these resources and how to find what you need easily on our website. And as we get to those questions that are coming in for Monica, I'm going to go ahead and, as promised, leave up the contact information for both Triage Cancer and NeedyMeds. So with that, let's get to the questions. Here's a great one, and one I bet you get asked all the time, Monica, which is, I have insurance through my employer, but the policy doesn't cover the doctors I want to see. Am I stuck?
So definitely a common question. Prior to the Affordable Care Act, I think that we were all sort of trained, and it was ingrained enough that if we got health insurance from our employer, that we held on to it for dear life and never let it go. But now, thanks to the Affordable Care Act, we have some additional options. And I actually recommend to everybody, and this is something I do myself, every open enrollment, I go and I take a look at what's available to me in the marketplace. And I see, what can I purchase, and are there better plans out there? And in that person's situation, sure, they might have a quote unquote great employer plan, but if it doesn't cover the doctors that they want to see, that plan is effectively useless. So I would absolutely recommend that come open enrollment, they take a look at what's available to them in their marketplace. They take a look at if there's other plans they might be eligible for, like a spouse's plan, or if they're a young adult under the age of 26, take a look at their parents' plan, because it may be that they have some other options that do cover those doctors, and again, will then maximize the plan that they're able to choose.
Thanks so much, and thanks for the question. Another question coming in is, I'm offered insurance through my employer, but every year I feel like I'm paying more and more out of pocket. Do you have any suggestions?
So that is, again, a very common thing that we hear. People sometimes forget that insurance is like any other commodity, and as the quality of the product improves, the price tends to go up. And because of the Affordable Care Act, they now have to cover all of these preventative services and participation in clinical trials. And so the quality of what you're buying has gone up, and so has the price. But even if at that point you think that it's still just unaffordable, or not, the quality and the price don't quite match, again, I would recommend that you take a look at what's available to you in the marketplace, because there is nothing that says that we have to keep our employer-sponsored health insurance.
Great. Thank you. And again, thank you for that question, because I often feel when our audience participates by asking us questions, the chances are if one person is thinking of the question, other people are as well. A great question. This is, I'm geared towards NeedyMeds, which is I'm having trouble affording medications. Where should I start my search on NeedyMeds? So I'm happy to have a moment to point this out. As I mentioned, the patient savings tab on the top navigation bar is where all of the NeedyMeds healthcare cost savings resources can be found. if you are looking for help affording a specific medication, the easiest thing to do is on our homepage on the top left-hand side, you will see a field where you can literally, and it says drug search, where you can type in the name of your medication, be it name brand or generic, and just simply click on drug search. That will automatically search our site to see if there is a health cost savings program available, whether there's a prescription assistance program or a coupon available, that type of thing. You can also, if you are looking for help affording something outside of medication, because as we all know, oftentimes we are paying for things sometimes out of pocket that cost a lot of money that don't necessarily fall neatly under that umbrella of medication. Sometimes we're looking for help affording assistive technology or medical equipment. If you're looking for something that doesn't fall neatly under that medication category, what I would suggest doing under that patient savings tab is in the center section, you'll see a category for diagnosis-based assistance programs. So that's another great place to start. I do see a bunch of other questions coming in for help affording specific medications. And if that's the case, what I suggest doing is, again, type it into that drug search bar on the NeedyMeds website, or call our expert call center counselors at that number on your screen. That's 1-800-503-6897. Our counselors are here to help you Monday through Friday, 9 a.m. to 5 p.m. Just keep in mind that we are in Massachusetts, so that's Eastern time. And of course, you can always check out triagecancer.org or call that number on the screen as well. Let's see. We got a bunch of people, and thank you for this, asking for copies of the PowerPoint slide decks, and you should be able to download those in the handout section of your GoToWebinar control panel. If you're still having difficulty, don't hesitate to send me a message, and I'll be happy to email them to you after the presentation. So we do try to keep the question segment of these presentations brief. So again, if we didn't answer your specific question, we will certainly follow up with you via email. With that, I want to thank everyone for taking time out of their busy day to join us, and a big thank you to Monica for sharing her expertise with the NeedyMeds audience. Thanks so much, everyone, for your time, and have a great day.